Welcome back to What's Up Elgin. I am your host, Anita Twynstra-LaRue, and today we're going to talk. I'm talking to Alicia Connolly. Alicia, thank you so much for coming on the program. But we are going to talk about autism. A lot of people aren't aware of what autism really is, and Alicia is a behavioral therapist that works strictly with autistic children. Is that what you do, Alicia?
Yes, mostly with children with autism. Anything that's government funded,
right,
for the therapy would be just with autism, but they've found that the therapy in general is effective for, well, any child, because that's just the way we learn. So.
Now, autism, if we could put it down to some description for the viewers to really understand what autism is, how would you go about describing what autism is? What is autism?
So the main deficits in autism are language, so they have a big language deficit. They don't always understand expressively and receptively. Socially, I think that's a very well-known deficit with autism.
Now, socially, is there a mild autism to?
It can vary on the spectrum. I mean, it's a spectrum. So autism is like autism spectrum disorder. So they can kind of vary on the spectrum. And I mean, every child's different. But generally, to have a diagnosis of autism, you have to have the language deficit, the social deficit, and restricted behaviors and restricted and repetitive behaviors and interests. Sorry. So that would be like obsessions with trains. You see that a lot.
Where it's a continuous obsession, where it's constantly there.
Yeah.
Is it true now? I work for Community Living Elgin, and I have worked not a lot with adults with autism. The emotional portion of it, I mean, what I see is the I focus. Is that in autism? Is it being in your own world when somebody is diagnosed, or a child and like we were saying, we're talking about a spectrum. So not every child's going to be in their own world. It all depends on what it is. But in order to be diagnosed with autism, you have to have those certain areas in order to be diagnosed, right? But do you find that with a lot of the children?
It's very common for them to not always have eye contact or avoid eye contact. The reason for that is that they have the social impairment. So socially, they have to learn things. They don't learn it the way the typical child does, where people look at you, so you look at them.
Right. They
have to be told that you are supposed to look at someone in the eye because that is what's socially appropriate.
Yeah, absolutely. Yeah. And with children, when does a diagnosis? When would a parent actually see, or a caregiver see, that a child could possibly have autism? What is an age group?
They can start seeing signs about 6 months.
6 months, really?
The average diagnosis is around 2 years old.
And is that more the eye contact that they're just?
Well, that or the restricted and repetitive behaviors. So like a really common one would be hand flapping or vocal stimming,
right?
Or lining things up. A lot of cars or toys, lining them up and needing things in specific orders, having a very hard time with routines, like any change in routine.
So very structured.
Yes.
Very, very structured.
Yes.
You get out of that routine and
causes a lot of anxiety.
Yeah. And you can see that at 6 months old.
Yep, they start to see signs, and I mean, I think that's more a parent that would notice that in their child because they see them every day.
Right.
I don't think it's going to be aware to everyone around them at 6 months old, but a lot of parents, that's when they sort of notice.
Yeah, right. 6 months old to as they get a little bit older.
Yep.
Well, like I said, Alicia Connolly is a behavioral therapist, and it's mainly children with autism, a little bit more than that. She is so young. She's 23 years old, and I'm so glad to have her on the program to give us a really good idea of what autism is about. But please stay tuned, find out more, and we'll be right back with What's Up Elgin. Welcome back to What's Up Elgin. I'm your host, Anita Twynstra-LaRue, and I have Alicia Connolly on. She's a behavior therapist for children that have autism, and you do a lot of the funded by the government. That is mainly, you're in the home with the children.
Yes.
And you spend every day with them, homeschooling children with autism. What is your day like, Alicia, with a child that has autism and trying to get them to learn differently? We all learn differently. Every single one of us learn differently. What do you see with a child with autism? What are you trying to accomplish?
Well, with the in-home therapy, there's generally a team. So it's overseen by a psychologist. So that's our clinical supervisor.
Okay.
And they're generally also a board-certified behavior analyst, which is like the top of the field there.
Right.
And then we have a senior therapist who kind of supervises and runs all our programs. And then there's the rest of us that do the therapy with the child. And so what'll happen is about every month to 6 weeks, we'll have team meetings with all of us and the family, like the parents, and we'll talk about goals. So what's most important? What do they really need to be doing right now? Or what's next based on what they've learned? And then we go from there and decide on kind of different programs that we're going to run with them. Like, what do they need to learn? And then we break it down into steps that are attainable for them.
Right.
So,
and it would go by age group as well, right?
Yes, for
so
sure.
So if you're in there, would you be with a child that's age 2, age 3, getting them ready to go into grade school? Or
yeah, there's a lot of kids that if they have an early diagnosis of autism, then they'll start as soon as possible. But there are other children that get late diagnoses where, you know, maybe doctors didn't see it, or maybe they're one of various siblings, or for whatever reason, it wasn't really as pervasive for it to be noticed.
Right.
So they got a later diagnosis, and there's various kids that are like 9, 10, 12 in therapy, and so when it comes to that, then you have to be more creative, because usually therapy is based off of the basics of learning, which would happen when you're 2, 3, 4.
Yeah, absolutely.
So when it comes to them, you got to change things up a bit, where it's not just teaching them colors and it's not just teaching them this. You need to teach them life skills too.
Right.
But in the same sense, I mean, if you're going to teach them how to vacuum, you have to teach them that the first thing you do is plug it in. And you can't put your thumb where the socket is, and this is how you plug it in, and then you have to unravel it, and then you have to turn it on. And then you also move it back and forth. It doesn't just happen. Right. So anything like that is broken down into the smallest steps, and as soon as they can attain every step, that's a success. Wow. It's an amazing success, and they get so excited about it. Like, they love when they're doing good.
Yeah, exactly. And so that would be, how long would that take for you, for the program to continue until they get into grade school? Like, if you start at 2, are you going throughout the week, twice a week, with, say, somebody that is 3 years old?
So if someone's in full-time therapy, it can be anywhere from 20 to 40 hours a week.
Nice.
So like if it was someone 9, 12 years old, they would not be in school. They would be out of school for that time, and that would be their homeschool, right?
Okay, right.
So it really depends on how fast they're achieving goals, how fast they're learning, what else they do need to learn next to their peers.
Okay, and you know what, Alicia, we have to go to a quick break, but we're going to come back. We're going to talk a lot more about behavioral therapy with children that have autism, and Alicia's going to give us all the experience that she's had at 23, and we'll be right back with What's Up Elgin. Welcome back to What's Up Elgin. I'm here with Alicia Connolly. She is a behavioral therapist with children that have autism. We are also talking at break, and Alicia plans on going to Brock University. Is that your plan?
I'm doing some prep courses at Brock so that I can get into the OT program, occupational therapist program at Western.
Wow, so, good for you.
Yeah.
Yeah, you've been she's a busy girl. She's a busy girl doing lots of good things for a lot of children. Alicia, the long-term goal for both the parents and the children that you are working with, what do you see the long-term goal? I mean, everybody has a different long-term goal, and I keep kind of stressing that, because everybody is an individual. You know, to say that every child that has autism, here's their long-term goal, is totally unrealistic. That's like saying I should become a rodeo whatever rider or something, you know, because that's not my long-term goal. But I wouldn't want anybody to place that on me either, right?
Yeah.
So and of course there's a perspective, as we were saying before, for every parent and every child. And but what do we really want the long-term goal to be for children?
I think the main long-term goal from therapy is for them to be able to learn from the natural environment. So that's what we're teaching them. We're teaching them how to learn, right? So if we can teach them as much as we can so that they can learn as independently as possible, then that's success.
That is success.
And so whatever level they can attain that at, if they're doing whatever they can, then that's all that matters.
Yeah.
So as long as they're happy and
happy and healthy,
and can do as much as they can.
And autism and the therapy for autism has come such a long way, such a long way. When I remember being a child, and there was children that, I mean, now I know had autism, there was nothing out there and nothing available for these children. You know, the stigma that became attached to that was absolutely ridiculous, for one. It was years ago.
Yeah.
But now we have so much more that we can give to our children. And you are definitely one, and that we're being funded by the government to continue doing the therapy that these children need. And not only that, but any other disorders that are out there. It's just amazing what we're able to accomplish now. Now, Alicia, if a parent wants to get involved in this program or become involved in being with you behavioral therapy-wise, where do they start? Where would they start to get?
So I guess that depends on if there's a diagnosis of autism. You go straight to your family doctor, get all that sorted, and then you would go to Thames Valley Children's Center to apply for funding for the program. Now, if you can't get funding, there are a lot of families that will still do it anyway, and they pay out of pocket, and it may be a little costly, but it is always worth it in the end.
Okay, and we're going to talk to Alicia a little bit more about the funding and what parents can do to help them and the success of their child. And we'll be right back with What's Up Elgin. Welcome back to What's Up Elgin. I have Alicia Connolly here, who is a behavioral therapist for children that have autism. I've worked in this line of work and it's been my career for 24 years. Not as much in the autism area, but Alicia is here to give us a lot more information. Before break, we were talking about if a parent suspects that their child could have autism, where they can go, and Alicia was saying, again, she's going to go through a list of what we can do to help parents and what they need to do in order to help their child as well. So Alicia, first, go to your family physician.
So you would always start with your family doctor, and then they can refer you to any specialists. And from there, you would go to Thames Valley Children's Center.
Is that here in town, or
that's
is that in
London?
Okay.
At Victoria Hospital.
Okay.
Or London Health Science Center.
Okay.
So, and they would do the assessments, and then you would get waitlisted. So there's a waiting list for therapy. So
is it usually pretty long? Can the wait list? Is there something that a parent can do in that time if they have to wait?
In the meantime, they can have therapists come in.
Okay.
And they can do that on their own. That they don't have to just do it through funding.
Okay.
And I mean, you can always have like support workers that are also behavior therapists and just help their kids along a bit more. And if you're ever looking for a behavioral therapist, there's two ways you can do the therapy. So there's the direct funding, where the parents get the money, and that's where I work.
Right.
So the parents get the money, and then they hire their own therapists and their own team.
Okay. Yeah.
And then the other option is that Thames Valley Children's Center would have their own therapy room. And it's kind of set up like a classroom because it is like school, right? And they provide all of the therapy, the therapist, the psychologist, and all of that. So those are your two options.
Right, okay.
And before you can get either of them, you are always welcome to hire your own therapists and team, and then go from there when you are approved of funding.
Right, right.
And if you were looking for therapists, you can go just Google Abacus list.
Yeah, and that's ABACUS list.
Yeah.
And the Abacus list is, again, all the therapists that
It's a directory of behavior therapists or behavior analysts, anyone that works in this specific field.
Okay.
So.
And that's where they can go after that.
Yeah. And it's a full directory. It goes by region.
Right, okay, good. So it gives all the information needed for any parent that needs, or caregiver that needs to find out more about the therapists in and around the area. We were talking about this can be a delicate subject. I don't want to offend anybody, but we were talking about, in order for anybody, even myself, when my son went through being diagnosed with ADHD, you have to be labeled. And labeling for a parent, and I was saying this to Alicia myself, how hard that is for a parent to actually say my child has autism in order to get the funding.
Yeah.
Because that is part of what does happen. Have you found this very difficult for parents? Have you seen children go without funding? Because
there is some kids that I work with that got later funding, and I don't know if it was doctors or,
right.
You know, that just tends to happen, right? But I can't possibly imagine how hard it would be to come to terms with something like that in your life.
Right.
That would be unimaginable.
Yeah.
But by the time you do, and you can accept a label like that, you can get all the help that you need.
And that is the focus.
Yes.
And that was something very hard for myself as a parent to actually say, you know what, I have to, in order for me to get the help that my son needs, I have to label him. But the label is no longer an issue anymore, because now he is 14 and thriving and doing really well. Without that label for Alex, and probably for many of the children that you work with, without that label, we can't get the help that we need for our kids. So I'd love that stigma to go away.
Yes.
Yeah, it'd be nice, wouldn't it? Yeah.
Just and anything mental health. Like
yes,
that.
Anything mental health. It is very tough out there. But behavioral therapist, we have Alicia Connolly. We are going to have to go to break. I think I have about 5 seconds. But Alicia, we're going to come back. We're going to talk a little bit more about how we can connect with you and connect with other therapists in the area. And I want to thank you so much for getting it out there. You know, talking about autism, talking about anything that has to do with disabilities can be very, very difficult for a lot of people. So I'm glad that we are talking about this, and we'll be right back with What's Up Elgin, and we'll be right back with Alicia Connolly. Welcome back to What's Up Elgin. I have Alicia Connolly here with me. She is a behavioral therapist for children that have autism. And it is a delicate topic sometimes, and sometimes it isn't. I mean, I'm very open, and Alicia is too, very open about talking about anything health-related, mental, anxieties and stuff. That we've had Anita May on here, that we've been very open about talking about issues that happen, because they do happen. And with Alicia being 23 years old, and I keep saying that, but I'm always amazed when we have such young people that come in with such passion for what they do, and Alicia definitely has that. And she's going to tell us, because we need to hear some success stories, Alicia.
Yes.
And you've had a few.
Yes.
Not only that, but you have your brother Tyler. There were reasons why you became a behavioral therapist as well. Tyler Connolly has a cerebral palsy, and we just did a big thing with your dad called The Bridge, and talking all about All Source Depot, which your dad owns here in St. Thomas, and also about Tyler and all the successes that Tyler's had. But I want to hear about a success that you have had as a therapist with some of the children.
So I can't say that I can take even a half majority. credit. I wouldn't give myself any credit for this story. This was more of, these are therapists that I work with. I work with amazing therapists. They are the best mentors I could possibly ask for. And while I was on my placement before I was working in the field, one of the clients that was in therapy, who had a bit of a later diagnosis, and family just wanted to get things going, and she went from doing nothing when she was at school, and I mean, there's just not the supports for it.
Right.
And she, in 6 months, went from learning her entire alphabet to reading at a grade 2 level. She reads chapter books now.
Wow.
And she was told she would never read or write.
Yeah.
And just crazy things like that.
Yeah.
Like,
it's amazing because it's got to be very rewarding for you.
Yes.
Right, because I mean, there really is when you're being told that a child can't do something, it almost makes you want to do it.
Oh, that's the whole point of it.
You want to prove it, right? And the child does too, right? You can see they want to learn. That's what children do. They learn autism, whatever. Yeah. So you definitely have a position to see such an rewarding success with these children. And you know what, Alicia, I want you back on. I want to hear more. The show is over, I'm being told, but I want to thank you, Alicia, for coming on. And please stay tuned to What's Up Elgin. We are on weekdays on Rogers TV, and see you soon and take care. Oops.